Now, I will show you passive movement for first combined hip and knee flexion, extension and abduction. Second, knee flexion, extension. And third, ankle dorsiflexion and plantar flexion. The patient is in lying position and I should stand ipsilateral to the affected side of the patient. For the each motion, it should be smooth and rhythmical and the repetition rate maintained at even tempo. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And for combined hip and knee flexion, the patient is in lying position and I should stand ipsilateral to the affected side of the patient. The starting position is patient's knee is flexed slightly. For the hand placement, my right hand supports the heel. My left hand supports the distal thigh or posterior of knee joint. Then lift and flex the hip. As the knee flexes full range, swing the fingers to the side of the thigh. Repeat the movement for 10 times. Next is passive movement for hip extension. The patient is in side-lying position with the affected leg on the top. I should stand behind the patient. The starting position is hip is in neutral position. For the hand placement, my right hand supports the mid part of distal thigh. My left hand stabilizes the lateral part of pelvic part or hip joint. Then extend the hip. Repeat the movement for 10 times. Next is passive movement for hip abduction and adduction. The patient is in supine lying again and I am standing on the affected side. The starting position is knee fully extended in neutral position. My right hand is under the ankle and my left hand supports the posterior of distal leg. Abduct the hip. Repeat the movement for 10 times. For full range of adduction, the opposite leg needs to be in a partially abducted position. Then adduct the hip. Repeat the movement for 10 times. Next is passive movement for knee flexion and extension. The patient is in side-lying position with the affected leg on the top. I should stand behind the patient. The starting position is hip is in extension or neutral position. For the hand placement, my right hand grabs the medial part of ankle. My left hand grabs the medial part of distal thigh. Then flex the knee and repeat the movement for 10 times. Next, extend the knee and repeat the movement for 10 times. Then I will show you passive movement for ankle plantar flexion. The patient is in supine lying position and I should stand on the affected side. Starting position. Put a pillow and towel under the cuff to raise heel off the bed. For the hand placement, my right hand grabs the plantar aspect of the midfoot with hand crossing fingers on the medial side. My left hand grabs the dorsum of foot. Then plantar flex the ankle. Repeat the movement for 10 times. For passive movement of ankle dorsiflexion, use the same starting position as with ankle plantar flexion. For the hand placement, my right hand grabs the posterior part of heel with forearm across the plantar surface. My left hand grabs across the dorsum of foot or distal lower leg. Then dorsiflex the ankle. Repeat the movement for 10 times.